Heat and cold therapy are often recommended to help relieve aching pain that results from muscle or joint damage. Did you know that a hot compress can also alleviate a stomach ache? Which type of therapy do you opt for? A cold pack or a hot pack? Frequently debated among individuals, but did you ever really think about which one is appropriate? So you have a massive migraine, or your arthritis is acting up, you're experiencing a pinched nerve, or you sprained your ankle. Before you rush off and douse yourself in an ice bath, I'm here to break down whether cold or hot therapy is appropriate for your injury. Hey everybody, I'm Dr. Jordan Wagner. I'm a board certified emergency medicine physician, and on my show, I answer your urgent medical questions and clear up myths about certain deadly diseases. If you haven't already done so, please hit the subscribe button and turn your bell notifications on. That way you're notified when I post a new video. For the record, in some cases, alternating between hot and cold compresses may be helpful, but there are many instances where cold only or hot only may be better suited for your injury. We are going to go over all of that today. So what exactly is cold therapy? Cold therapy, also known as cryotherapy, reduces blood flow to a recently injured area, typically best if utilized within 48 hours of an injury occurring. This slows the rate of inflammation and reduces the risk of swelling and tissue damage. Cold therapy also numbs sore tissues, acting as a local anesthetic, and slows down the pain messages being transmitted to your brain. What is cold therapy useful for? A cold compress is best if you're experiencing an ankle or knee sprain, muscle or joint sprain, hot or swollen body part, or acute pain induced from intense exercise. A cold compress is best used on recent injuries, especially where heat is being generated. Cold compresses are not recommended for chronic back pain due to the fact that this pain is not new. Cold compresses aren't that effective on back injuries. This is due to the fact that the problem tissue that is inflamed is located deep beneath other tissues and far from the surface of your skin, where the cold compress will obviously lay. Back pain is often due to increased muscle tension, which can be aggravated by cold treatments. For back pain, heat treatment might be a better option, which we'll dive into in just a second. Again, a cold or chemical cold pack should be applied within 48 hours from the time of the cause of the injury to the site in which you are experiencing discomfort. Apply the cold compress to the inflamed area for 20 minutes every 4 to 6 hours for about 3 days. You can also do 20 minutes on and 20 minutes off for about 3 rounds. Ice should never be applied directly to your skin. This can freeze and damage body tissues, possibly leading to frostbite. What are the types of cold therapies? A cold compress can be made by filling a plastic bag with ice or frozen vegetables and wrapping it in a dry cloth. A cold mask or wrap around the forehead might reduce the pain of a migraine. For osteoarthritis, patients are advised to use ice massage or apply a cold pad 10 minutes on, 10 minutes off. When is it appropriate to use cold therapy? You should never apply cold compresses on an open wound, or if an individual has some type of vascular disease or injury in which nerve disorders affects blood flow. So what exactly is heat therapy? By applying a hot compress to an inflamed area, this will dilate your blood vessels, promote blood flow, and help those sore, tight muscles relax. Our bodies typically build up lactic acid waste after physical activity. In an effort to eliminate that lactic acid buildup, a hot compress will promote circulation, resulting in the elimination of the lactic acid buildup. Similar to lactic acid buildup in our muscles, our stomachs will build up a similar acid, resulting in a nasty stomach. So next time you have a stomach ache, try applying a warm compress to the abdominal area to eliminate acid buildup. Heat is also physiologically reassuring, which can enhance the analgesic properties. Heat therapy is usually more effective than cold at treating chronic muscle pain or sore joints caused by arthritis. What is heat therapy useful for? Heat therapy is useful for treating osteoarthritis, strains and sprains, tendinitis or chronic irritation and stiffness in the tendons, warming up stiff muscles or tissue before activity, and relieving pain or spasms related to neck or back injury, including the lower back. Applied to the neck, heat may reduce spasms that lead to headaches. However, the effectiveness of heat treatment may depend on the depth of the tissue affected by the pain or the injury. What are the types of heat therapy? Electrical heating pads, hot water bottles, hot compresses, or a heated wrap. Soaking the area in a hot bath between 92 to 100 degrees Fahrenheit or 33 or 37.7 degrees Celsius, heated paraffin wax treatment, or over-the-counter topical medications such as rubs or patches containing capsaicin. Heat packs can be dry or moist. Dry heat can be applied up to 8 hours, while moist heat can be applied for roughly 2 hours. However, moist heat is believed to act more quickly. Heat should normally be applied to the area for about 20 minutes, up to 3 times a day, unless otherwise indicated. Single-use wraps, dry wraps, or patches can sometimes be used continuously for up to 8 hours. When should I not use heat therapy? Heat therapy is not appropriate for all types of injuries. Any injury that is already hot probably won't benefit further from warming it, especially burns. Stick to cold therapy for that. Similar to cold therapy, heat should never be used on an open wound, inflamed skin, or if you have insensitivity to heat due to peripheral neuropathy or other condition. Most importantly, always double check with your primary care physician about whether or not heat or cold therapy is appropriate for you. For instance, if you experience high blood pressure or heart disease, utilizing a cold or a hot compress could actually lead to a series of problems. Now, doctor, what about alternating hot versus cold therapy, or is that just a myth? Alternating between hot and cold therapy is also known as contrast therapy, can be beneficial in some cases, such as individuals who have chronic pain, such as muscle or joint pain. Both ice and heat bring something to the table in terms of pain relief and healing. However, choosing one or the other just might not provide enough relief. This is when contrast therapy comes into play. When cold is applied to the body, our blood vessels contract, or in science terms, vasoconstriction is occurring. When vasoconstriction is occurring, circulation in our bodies is reduced and pain decreases. Removing the cold causes vasodilation, as the veins expand to overcompensate. As our blood vessels expand, circulation improves, and the incoming blood flow brings nutrients to help the injured tissues heal. Contrast therapy reduces inflammation, stimulates circulation, and loosens up tight muscles, relating to overall pain relief. It's the best of both worlds. Science has yet firmly established the effectiveness of heat and cold therapies, but neither treatment is very potent, and the danger of an adverse reaction when applied to a particular point on the body is usually low. Individuals with chronic pain or a non-serious injury can try either method and find their own best solution. Let's recap. Cold therapy reduces inflammation by decreasing blood flow to the area, applied within 48 hours after an injury. Heat treatment promotes blood flow and helps muscles relax. If you're experiencing chronic pain, stick with this. Alternating between heat and cold may help reduce exercise-induced muscle pain or chronic conditions such as osteoarthritis. And as a friendly reminder, never use extreme heat and never put ice directly on your skin. All right, that's been a quick hot versus cold pack conversation with me, Dr. Wagner. Let me know in the comments if you have any other medical questions that you'd like me to answer. And as always, make sure you hit the subscribe button and turn your bell notifications on. Thank you so much for watching, and stay healthy, my friends.